These are going to be the bones of the pectoral girdle. So there's only going to be two bones that we're going to consider here. The first one is going to be on the anterior aspect of the pectoral girdle, and that's going to be your clavicle. And you can see that the clavicle is this S-shaped bone. Here we're only going to consider three structures of this bone. If we look at the medial end of the bone, this is where you have your sternal end. So this is the end of the clavicle that's going to articulate with the sternum, right? With the manubrium of the sternum. Notice that it's fairly square and broad. As you make your way towards the lateral aspect, on the inferior aspect of this bone you have the conoid tubercle. So this conoid tubercle is helpful in identifying left versus right, because in standard anatomical position the conoid tubercle is always kind of pointing down and back, right? So inferior and posterior. As long as you orient it in that manner, you're going to have it in standard anatomical position. And from there, you just need to identify the last region here that we're going to consider, and this is going to be the acromial end of the clavicle. The acromial end is what's going to articulate with the acromion of the scapula that we're going to mention here in a second. So that would be the lateral aspect, medial aspect. This is posterior. So in this case, you're looking at a right clavicle. That's the clavicle. For the second bone of the pectoral girdle, you're going to want to focus on the scapula. And you see that the scapula is this kind of flat triangular bone. Some of the features that allow you to distinguish left versus right will be the glenoid fossa or glenoid cavity. Right, so this is where the head of the humerus would articulate. So this part of the bone has to be lateral, right? So it has to be pointing lateral. Just anterior and superior to that is where you see the processes of the scapula. Here you have the coracoid process, right? Coracoid process, and just posterior and superior to that, you have the large acromion, right? Sometimes referred to as the acromion process. If we move posterior or kind of medial to that acromion, you see the spine of the scapula. Spine of the scapula. And this spine is always going to face posterior, right? So right now we're looking at the back or the posterior aspect of the scapula. So to determine left versus right, you always point the spine posterior. The glenoid fossa should then be lateral, and you can determine left versus right. And in this case, this is going to be a righty, right? Because the humerus again would articulate here. As far as the other features of the scapula, separated by the spine, you have two fossas. This is going to be the supraspinous fossa, and this is going to be your infraspinous fossa. In life, there would be muscles here that would be resting within those fossas. Right? Along the superior border of the scapula, you have your scapular notch. Right? We make our way down this medial border of the scapula. That's going to take you down to the inferior angle. And then as you make your way back up, you go along the lateral border. Right? So other names for lateral border and medial border would be the axillary border, because of its proximity to the axillary region. And then for the medial border, the vertebral border, because of its proximity to the vertebrae. If we make our way towards the anterior aspect, here you see the very large subscapular fossa. Right, so subscapular fossa, again in life there would be a muscle here that would rest in that region. Right? Aside from that, you have the lateral angle, the superior angle, and then the lateral angle here. And that's it.